Our today's lesson will be based on the eye. Eye anatomy simply means the structure of the eye. But let's begin with the anatomical drawing because the best thing to learn something in biology is to draw it. This little indentation will be our cornea, and then the outer part, there is a division here, there is a division here, and then this particular first layer of the eye, we call it the sclera, and then this particular area here, we call it the scleral venous sinus. I will tell you the function of this particular thing now. And then this front part, we call it this your cornea. We call it this your cornea. Do you see that we have the first layer of our eye? So what is our second layer, and then what is the function of our second layer? But also it's important for us to understand that this is the tough fibrous tissue. The word sclera means hard. This is the wide part of your eye, and then the entire eye is situated in what we call is a bony orbit in a human being. Of course, this is we're learning an eye of a human being. We do have our second layer, which will rise from here and go all around. Will rise again from here. There is no substitute in drawing your own image. It's okay, you can draw your own image. But I want you to be precise. Do you see I've this particular second layer? I started the layer, but I've left it in the middle. I have a reason for that. Here in your scleral venous sinus, you are going to be documenting your iris like this. I'm just giving you a tip on how to draw an eye. Do you see? This will be your iris, but now this is not a complete choroid. Let me show you how will it look like. This will now be your complete choroid. The second layer of our eye, it will be what we call is vascular layer, because we know in the heart when we do the vascularity, vascular has to do with blood, but in this case, we will name it choroid. This is our choroid layer. This is responsible for distributing blood to the most part of the eye. But do you see that this is little bit artificial? I just want to show you. Little bit, because this is divided into three components. Here we find muscles. We will have our muscles here. in this body. But the name of this body is ciliary body containing muscles. Be precise. This and this is the same. This is our ciliary body with muscles. Our ciliary body contains ciliary muscles. So this now, from here to here, from here to, this is now your iris. Now again, be precise. This and this is the same thing. Now, do you see that we have a gap which is transparent? From here to here, we do have a gap. What is the name of this gap? It's a pupil. This gap, let me just put a dot here and then show you an arrow, and then I call this pupil. Pupil is actually a hole that go inside your biconcave disc. Biconcave disc in a language that can accommodate a grade 12 learner, it will be a lens. This is now your lens. This is now your lens. But now, this particular lens needs some sort of structures that can get attached to it, some sort of structure that can control it, that can help it to focus on a close object and a far object. So we will have what we call ligaments. We will have our ligaments here. All this has to do with this suspensing the lens. What is the name of this thing that are attached from our ciliary body and then control the overall of the lens? What is the name of this little bit spindle things that you see here? This will be your suspensory ligaments. Suspensory ligaments made of what we call is a zonular fiber. This is where they are coming from. Again, be precise. This is your suspensory ligaments. This is your suspensory ligaments. Now I'm going further now. We do need some sort of another layer because this layer in total there should be three of them. Now be precise. The third layer is coming from within. Do you see? Did you see where did it end? But in an actual sense, it does not end there. I will again educate you what is happening there. Now, what is this third layer? Because we know our first layer is our sclera, the second layer is our vascular choroid, the third layer is our retina. But this retina is divided into two components. We can either name it a visual retina. This is your visual retina, right? And then we do have this particular layer continuing, but on low surface like this, rising in ciliary body and then ending somewhere around the inner part of the iris. Same apply this side again. Now the common question is, what is the difference between this retina and this retina? Because it's the same thing. It's just this one is continuous. This one now is the non-visual retina. This one. Non-visual retina. This one, let me rather put it this side because I see this side we do have little space. You see, from here to here, we have our visual retina. From here to here, we have our non-visual retina. So what is actually happening here is that here there is little bit of indentation here. There is little bit of indentation here. Normally this is a hole. The name of this indentation, we call it is a fovea centralis. This is where the image will focus, and this is also rich in cone cells and rods. Fovea centralis. And then we do have another layer. Let me just color this a bit. We do have a chamber that is covering the entire area here of the eye. Large chamber. What is the name of this layer, of this particular chamber just after the lens? What is the name of this? We call it, this is a vitreous humor. Let me just write it for you quickly. Vitreous humor. Or you can call it a vitreous chamber, but it's actually the same thing, don't worry. But around here, the gelatinous material is little bit yellowish, not really yellow, but yellowish. Sometimes we call this a yellow spot. That is a matriculant language now, yellow spot. We do find our yellow spot somewhere around here. If you don't want to say yellow spot, we can call it macula lutea. Those of you who are studying with me, they will understand this particular lutea. We do find it inside menstrual cycle, corpus lutea. We do find it there. The word lutea actually means yellowish. Let me color this a bit. Our second layer, our choroid, we color it in red because it will distribute blood to the most part of the eye. Bear with me. I just want to do an anatomical structure that can be a little bit visible to everyone and then little bit understandable also. This is our choroid. Continuous with the iris. Same apply this side. Education is so nice when you are determined to study, but those of you who don't want to study, that's your choice. This is just a simplified diagram of an eye. If you study this 2, 3 times, you watch this particular video, you can never fail the eye. As I said earlier on, there is no substitute drawing your own image, or you can draw one with me. That's your choroid. Let me give you your sclera. This part of the sclera means the wide area of your eye. The word sclera means heart, but sclera we find it in the wide area of the eye. And then cornea is really transparent. There is no color here. The only color that you'll come across is this particular iris. This is your colored part of your eye. This area here, it will be your sclera. Remember, sclera and cornea is the same layer. The difference is that this particular area is opaque. This one is transparent to not interfere with the transmission of light going inside of your eye. It takes a while, but it's fine. We do have now our retina. From here to here is our visual retina. There's our visual retina. From here to here, at the back of the iris, this is will be your non-visual retina. This one we cannot say is not useful. It is useful because it's part of the layer. The only difference is that this one is not visual. This one doesn't contain light sensitivity. The black part here we know is little bit, there is a hole there. The name of that hole, we call it is a fovea centralis. This area and this area is rich in cold cells to enable human beings to see in color visions. And then it's also rich in rods to enable human beings to see at night or to see when there is a dark stain areas. This is a human being eye. We do have quite a different eyes. We have roaches eyes, we have cow eyes. They function totally different from a human eye. We know that roaches see everything in red. We know that dogs don't see in color vision. This is now our eye. Remember this one, this particular one. This has to do only with our vitreous humor, this particular vitreous chamber. But now, this particular retina, when it reaches this particular area, when it passes here, when it's taking the image towards the occipital lobe in your brain, because you capture the image, the image will pass your cornea, which cornea is transparent, and then the lens will suspend the image will focus to fovea centralis, and then it will get and transport it as an electrical impulse But this image is really going to the back of the mind, which is one of the lobe in your mind. We call it this occipital lobe. That is where the image will be generated. But when it's passing this particular stage, we no longer call this retina. We will call it now optic nerve. Sometimes we can call it a blind spot. Sometimes we can call it neurological nerve. The difference is just anything that is carrying information towards the brain, it has to do with neurons. So we call this particular thing optic nerve or blind spot. It's actually the same thing. This particular area, this is now, the image now here is complete. That's why we call it an optic nerve. The image now is inside the nerve, approaching the hypothalamus, going to do what we call as chiasma, where they will interlink with each other, and then later they will go to a part of the lobe in your brain. We call it this occipital lobe. So now, let's continue with our image. Here we do have some arteries and veins. You know, this will distribute now the blood to the areas, because remember we need blood to survive. This now will distribute the blood. Blood is carrying oxygen. For this eye to be highly active, highly alive, we do need this. This now is your scleral venous arteries. This one, it will be your artery. This one, it will be your vein. Together, when they are like this, we call them are your retina, veins, and arteries. This will be now distributing and redraining again in future so that the blood can go again to cardiovascular system to pick up oxygen. Right. Now, we have documented quite few things of the eye, but if you can take a quite, if you can focus on this eye, you can see that this eye is not complete. What is it that must be documented again? I can't see the conjunctiva. I can't see it. So that is what now we must document. Falling back again. Now I want you to see, people. This and this are the same. Do you see what is happening here? Now we are trying to come up with the structure of, of the conjunctiva. This is your conjunctiva. This will be your eyelashes. This will be your eyelid. Eyelashes. Eyelid. People, now I want you to be precise. You see the inner layer of this particular thing, this one, pay close attention, please. Let me rather use this one. It's this one that the camera is focusing to 100%. You see this particular scleral venous sinus, it has the inner lining of this particular layer. From here, going with me, coming back with me, and then ending it here by the eyelashes is your conjunctiva. And then taking it from your eyelashes all the way backwards is your eyelid, right? This one, the lining of this layer inside only is our conjunctiva. Here, this one is our conjunctiva. Let me give you the spelling. conjunctiva. This one is a TIVA, conjunctiva. This is our eyelashes. This one from here going that side. This one is our eyelid. This one is our eyelashes. Now the question is, if anything, something like a foreign substance get inside your eye and then it come and stay here because they can't go back or they can't go further than this because of this conjunctiva. The activity of conjunctiva is to ensure that nothing can pass through this particular angle here and go back. Everything will come and stuck here, resulting in your eye becoming red, showing that something it is here. But when we do physiology, we'll be learning about diseases. If a dust, sticks, so on can come and penetrate your eye and come and stuck here, we call it that particular disease is conjunctivitis. And then when we have conjunctivitis here, it can really remove itself out that particular that it doesn't have that big effect. So now here we have our cornea. This is the continuous with the sclera. The difference is that this one is transparent to allow the transmission of light to come in. This one is opaque because it's inside the bony orbit. It has nothing to do with the light, this one. This one is your scleral venous sinus. I will tell you what is the function of that. Now people pay attention. This is where now I want everyone to understand. Remember, I told you about the retina, veins, and arteries that will come and distribute and drain blood within the vitreous humor. This part here is genitalous materials get formed when you are alive and when you are fit. So this particular eye needs oxygen and nutrients. So they will receive those through the arteries and veins. But now we do have another layer that is distributing blood to the most of the eyeball, but it does not distribute blood to the entire eyeball if you can take close attention. Look, we do have lens here. We don't see the communication of blood between this particular ciliary body and lens. Can you see where the movement of blood end up? Now, if it is like that, what can you say about the lens? Because the lens must also receive proteins, it must get nutrients, it must get some sort of oxygen together with this cornea, together with this area here, pupil, because pupil is just this. Pupil is actually a whole pupil. It's a whole. Pupil means a whole. From here to here, this area is a whole. And then the first thing that you'll meet after this whole is a lens. Now, I've decided not to color this particular cornea because it's transparent. It shouldn't interfere with the transmission of light. How do we get nourishment of these areas that are blood resistance? Because we see here there is no blood, we see here there is no blood. Here in ciliary body, we do have suspensory ligaments, and then we have ciliary muscles. Those muscles, they will produce what we call is aqueous humor. Aqueous humor will nourish areas of the eye where blood cannot go through. This side and this side are the same, meaning that also this side will produce aqueous humor, and then this particular aqueous humor will be traveling like this. This is quite a dangerous chemical. When too much is being produced or too little is being produced, you can be blind. This is the nourishment of the cornea, the nourishment of the lens. But now, remember one thing again. This is a continuous process now. We can't just nourish it and leave it here. So the question is, we know that this particular fibers materials are suspensory ligaments. That is their name. They are made of what we call zonular fibers. But what is the space? Look at the space between the suspensory ligament and the lining of this iris and the non-visual retina. What is the name of this? We call that this one is the posterior chamber. Chamber means a room where something is residing. Between this iris, this side and that side, we call it this anterior chamber. In case at school they ask you such question, you can be able to answer. Now, there is something that is going on. We understand when we do the heart, you learn. We have arteries and veins. Arteries are the blood vessels that are taking the blood away from the heart. We have the veins that are taking the blood, excuse me, towards the heart. This one now is a liquid. The name of this liquid, we call it is aqueous humor. This particular liquid that will come and nourish the areas where blood cannot go through. Aqueous, aqueous humor. Humor means liquid. Now, what will happen? Because we know that blood will definitely go back to the heart to pick up oxygen and nutrients and everything and oxygen. But now, what about this aqueous humor? This particular scleral venous sinus is the absorption of this particular aqueous humor. It will come out from your ciliary body, it will travel through your lens, it will pass the area of the pupil, it will pass the posterior chamber, it will overlap to anterior chamber, but later on it will get reabsorbed here, and then the veins will take it from here. This is a continuous process. It will be producing the ciliary body, it will travel from the ciliary body to your lens, and then it will get reabsorbed here. That will be happening again. This is a continuous process. It cannot stop because this area is blood resistance. So what is the question? The question is saying now, this area will come and appreciate light. By the way, this aqueous humor is a plasma-like material. This is low in protein so that it doesn't interfere with the transmission of light, meaning that this area is transparent for a reason. This one is also transparent for a reason. It should allow the light to go in. A light means, in a simplified term, is an image. Image will come in. So that's why this is a plasma-like material and low in protein, so that it doesn't interfere with the light. The light will come in and then it will bend towards your fovea centralis. Do you understand? When you reach the age of 40 years, this particular lens, it will lose its elasticity. It will be difficult for you to focus on a closed object, meaning that you will be suffering from what we call a senile presbyopia, but that I will be teaching that when we are doing physiology of the eye. This one is just to accommodate matriculum. This is just a short recap of the eye. Apart from here, there is nothing that can make you fail the eye. There will be muscles here. There will be muscles here that will be just controlling the movement of the eye. But overall, this area and everything that I've given you, this has to do with the eye. From the image will come and then it will bend here 75% towards your fovea centralis, because here is our target. The image don't pass through straight. It should get here, and then it will be later transported through the electrical impulse towards your brain, so that the occipital lobe can determine on how to accommodate a certain circumstances. So this is just your eye. Next time I will be giving you something else. Thank you for watching.